So I think I am going to start the meeting on time because this recording will be available later on as well if you want to listen to it later. So good evening, everyone. Dr. Shona will not be joining us, but the reason I thought we will talk about this is just post Diwali. So I've had a lot of messages why people can't come, and it was Bhai Dooj yesterday as well. So belated Happy Diwali and holiday season for all of you. So I thought it's we talk about breast cancer and breast cancer related treatments, but I think it's very important that all of us also need to be aware about other cancers because we have quite a few young patients and you would have relatives who need to be cancer aware because 1 in 5 men and 1 in 6 women will develop cancer before the age of 75 years, and the statistics are 1 in 2 in UK. The cancer burden by 2035 is just going to double, and I think that is related to a lot of lifestyle factors which I'm going to discuss about. The number of patients with cancer in India is rising, and the population matrix that we have is younger. We do have an aging population, and a better life expectancy. So that also has contributed to an increasing cancer patients. There has been a reduction in deaths from competing causes like diarrhea, tuberculosis, and malaria. The infection related cancers like stomach cancer and cervical cancer are going down, though the cancers like colon cancer and breast cancer are rising. In fact, in urban India, the incidence of breast cancer is quite high. And what I am seeing in my clinic is quite a few patients who are in their 20s and 30s with breast cancer. So I think some of you will have sisters, kids, nephews, nieces. It's very important to educate them about what they can do to prevent their risk of breast cancer. And yes, you may have beaten breast cancer or maybe living with breast cancer, but it is still important for you to be aware about other cancers and prevent them, hopefully. So. So cancer screening, I'll just talk about some of the cancers which lend themselves to screening. By screening, I mean, I think we've talked about breast cancer is when a test is done in a normal person, they go for the test and that shows that, they may or may not have cancer. So during the first couple of phases of lockdown, we stopped screening because we felt that, keep healthy people at home, don't use healthcare resources for screening. This also applies to some of you who have been on follow up for breast cancer. You may be due your annual mammogram or MRI scan or an ultrasound. So I think we've already delayed things for 3 months and now 6 months. And we know that we're not seeing the end of the pandemic. So it's very, very important that you do not delay your tests. I'm seeing quite a few patients in my clinic who've ignored their symptoms, and there has been a stage migration because they're coming in late stages. So it's very, very important to not forget that early stage means that the curability is high and the cost of treatment is low as well. How do we diagnose early? We talk about cancer and also be aware of what we can do, and that's why we are talking about this today. Very important for you and for you to talk to anybody you meet, including your friends, your family. There are some warning signs which are called the red flags. So, caution US is a nice mnemonic. So if you have anything that does not get better over a period of time, like change in bowel or bladder habits, a sore that does not heal, unusual bleeding. Now, the bleeding can be from anywhere, whether you have a nosebleed, blood in your sputum, in your vomit, blood in your stool, or if you've attained menopause, you develop bleeding, or you having periods, you have spotting every 2 weeks, even though, we are supposed to have periods every 28 days. So anything that is unusual, or there is an unusual discharge, you must get it checked out. If there is a lump anywhere in the body, indigestion or difficulty in swallowing. Now, indigestion could be, we always keep on attributing, saying that, it's stress related. I had too much spicy food. I had a glass of wine or whatever. So all of us find a reason as to why we have indigestion. So it's very important to remember that, that the stomach cancer is caused by a bacteria called Helicobacter pylori, and it is easily treatable with, penicillin and clarithromycin. So the antibiotics will completely get rid of it because it's a bacteria. So, and my cousin actually had this. She's in her early 30s, and she kept on complaining. I convinced her to have an endoscopy. In India, we do not have the breath test. I mean, if you have some centers which have a breath test, you can actually test the H. pylori in the breath, and that's called a flow breath test. And if it is positive, you do take antibiotics for H. pylori eradication. So for my cousin, I had her endoscopy done. She was H. pylori positive, and we gave her a course of antibiotics for 2 weeks, and everything was clear. So very important, always remember that there are two things that cause cancer: genes and environment. Genes, there is nothing we can do about it. Environment, yes, we can, because anything that is constantly irritating, let's say it's tobacco irritating your mouth, or the nicotine irritating the lining of your airways, or you're taking very hot tea which keeps burning your food pipe, or you have gastritis, which the bacteria causing irritation of your stomach lining, or so you anything that is causing constant irritation, there will come a point when the cells will not be able to regenerate in a normal manner, and they will go haywire. And that haywire division, whether it's increase in size or increase in number of cells, becomes cancer. So very important to remember all of these things. Indigestion, obvious change in wart or mole, there is nagging cough or hoarseness of voice. So again, we had a distant uncle in the family whose voice suddenly became hoarse, and everybody thought that, he's, it's related to his smoking or using tobacco, whatever. So, but again, it was much hoarser than before. It would not get better. We got his laryngoscopy done, and he had early laryngeal cancer, cancer of the voice box. So anything that doesn't get better over a period of time, 3 weeks or 4 weeks, I would get it checked out. It may be something very simple as, if you're losing weight, it could be something like diabetes or thyroid issue, but, we must make sure that it's not cancer. So, for each site, we have developed these cancer alert signs, which you have blood in the urine, repeated urine infection. For genitourinary cancer, have to rush to the toilet, trouble starting up or stopping the urine flow. So all of these are symptoms that, it may point towards a genitourinary. So we have about, I think in India, 60% of the cancers are preventable. Majority, like I said, have a lifestyle change. So I'll just spend a few minutes on this, and then, I'll talk about what the evidence behind it. So again, tobacco in India causes head and neck cancer, lung cancer, and also the nicotine in cigarette smoke or the tar and various carcinogens also cause bladder cancer, colon cancer. They've been implicated in breast cancer as well. So there is no cancer which has not been implicated in tobacco, and passive smoking is bad as well. So avoid tobacco, alcohol. Again, sun is important for vitamin D, but again, if you're out in the sun for a long time, use a good sun protective factor cream, which is about 30 to 50 SPF mainly. Oral contraceptive pill and hormone replacement therapy. I'll show you one slide on this. Again, if you use this for less than 4 years, the incidence, it does not increase the incidence of breast cancer, but if you use it for longer time, it can increase it. you can speak to your gynecologist and go for estrogen only pills, which are much safer than the other estrogen and progestin pills as well. So I think a discussion about the risks of breast cancer and these hormone pills is quite important. Avoid processed food. So if you look at the incidence of cancer globally, in the West, the incidence is very high. So let's say for breast cancer, it's about 1 in 5 in the West compared to 1 in 25 to 30 in India. And but we are catching the West, because the incidence of cancer is rising, mainly probably because of westernization of our lifestyle and dietary patterns as well. So avoid various supplements. If you're having a good balanced diet, you don't need to take supplements unless you're deficient in a vitamin. Again, the sugar, very controversial. I would say avoid sugar because that is linked to weight gain, and wider waist circumference, a higher body mass index is linked to breast cancer and colon cancer. B is for be vaccinated. Now, hepatitis B is part of our national immunization schedule, but I mean, I'm now based in Chennai and I've been seeing quite a few patients from Northeast and with liver cancer. And most of it is hepatitis B induced. I'm not sure, none of them had the hepatitis B vaccine. Again, all of you are there. Talk to your maids, your drivers, anybody you come in contact with. Make sure that they have been vaccinated for hepatitis B because it's freely available in the government centers as part of the national immunization schedule. HPV is the vaccine which prevents cervical cancer. Now, that is not part of the national immunization schedule, but this is something like anybody who's around my circle, whether it's patients, drivers, children, or whoever, I make sure that the young girls who are between the age of 10 to 25 are vaccinated against cervical cancer, because there is enough evidence to show that it prevents 80% of cervical cancer, and you need 2 doses. We used to give 3 doses, 0, 1, and 6 months, but I think there was a fantastic study from Tata Hospital by Dr. Shastri, which showed that only 2 doses of vaccine are enough. And in fact, they are looking now to see whether 1 dose of the HPV vaccine would be enough, especially in young girls. In the West, all the kids in the schools get the HPV vaccine. The girls and the boys get it as well to build herd immunity. In fact, Australia would be the first country in the world to eradicate cervical cancer. And that is by using the HPV vaccine universally in boys and girls, and also by doing screening, which I'll talk about. So, vaccine is not enough. You have to do screening as well. B is also for be breast aware, and I'll just briefly touch upon this, and also breastfeeding. I'm always asked what is the optimal time or duration that one should breastfeed. Again, the guidelines are that it should be more than 6 months, at least 6 months, but 1 year is ideal time that one should breastfeed. Again, stress is implicated in a lot of non-communicable diseases like diabetes, high blood pressure. So C is for calm and compliance. It's very, very important that, you have some form of stress coping strategy like yoga or meditation in your lifestyle. Compliance is very important for our patients, is compliance to your medication. If you're on hormone therapy, let's say whether it's tamoxifen, letrozole, or any of the other drugs, it's important that you continue on it. And if you're having side effects, don't stop it without discussing it with your oncologist. D is for diet. A rainbow diet is ideal. Try and have as many colors as possible in your diet. A balanced diet, which is low in saturated fatty acids. I think we had a fantastic talk by Dr. Claire Shaw on diet and breast cancer. And if you want, it is available on the website if you want to access Dr. Claire's talk. And we also had Luke Coutinho talk at a meeting which Dr. Sadine had organized on diet, exercise, and mental well-being. which I think was very sensible as well. That is something which you can access as well. E is for exercise. Again, very important. 30 minutes of exercise daily is prevents very good evidence for breast cancer and colon cancer. And I'll just show you a few slides on it. F is for family history. One must know what is the family history, whether you have a relative who's had breast cancer, ovarian cancer, prostate cancer, or pancreatic cancer, because all of these cancers are related to the BRCA gene. In fact, we are now talking about, for ladies who carry the BRCA gene, we do breast MRI scans from a young age. And there is now talk about whether we should increase the coverage of the MRI scan to the pancreas and scan the pancreas as well, because patients because people who carry the BRCA gene may develop pancreatic cancer as well, about 5% of them. So important that you know your family history. So having, like my grandmother passed away of ovarian cancer, that does not count as a family history because she died at the age of 87. So, as we get older, so it's important to know that which younger members of your family develop, and especially even if you have older members in your family, if there are more than one cancers in a close first degree relative. First degree relative is your siblings and your parents and your maternal or paternal grandparents. So if there are more than one person in your family who's had cancer, one must take some sort of counseling to see whether you need to undergo any form of testing. Follow up again for any cancer, especially breast cancer, follow up is very, very important. And I cannot stress it enough because during COVID times, I think I have done that as well. Patients who were coming at 3 monthly, 6 monthly intervals, I changed their appointments and I said, come the next month or 2 months later. But now, the COVID, like I said, has been going on for more than 6 months. So I think it's important that now we take charge and follow up with the oncologist for a clinical breast exam or a mammogram if you're due for your annual mammogram and you've already delayed it by 6 months. I think you should not ignore it. Sleep, I've talked about, there was a study from Spain which showed that, if you slept before 9 p.m. and had 2 hours between your last meal and going to sleep, the risk of developing prostate and breast cancer was about 20 to 25% less. S is also for screening. Now, yes, you have either beaten breast cancer or you are currently undergoing treatment for breast cancer, or you have finished all your treatments and are currently on follow-up. But screening is important for other cancers as well. So I would suggest that, yes, if you've completed your breast cancer treatment, don't forget about other cancers as well. So a question, is mammo better than a breast self-exam? So again, there was a study again which showed that if you had a breast exam by a specialist even once a year, that is good enough. And as far as mammogram is concerned, there are two schools of thought. And I must talk to you about all screening modalities because there is one school of thought which feels that unnecessary tests should not be done because, yes, it gives you radiation. It may increase the risk of other cancers down the line. But all of the countries, the high income countries with coordinated screening programs, have looked at the risk and benefit. And the benefit of doing a screening mammogram is being able to diagnose cancer at stage 0 or what I would say is a pre-cancerous stage. So the cancers that lend themselves to screening are the cancers I have listed. And they all present first, there's a long time period before they develop into cancer. So each of these cancers, there's a trajectory. So for breast cancer, the patients will have what we call the precancerous condition called ductal carcinoma in situ, which is stage 0 or early precancerous. and it can be picked up by mammogram as microcalcifications. Cervical cancer, you have cervical intraepithelial neoplasia. So at that stage, it is precancerous. And if you treat it, you get rid of it completely. And at the same sitting, when you have the testing, let's say visual inspection by acetic acid or by pap smear, which you can, at the same time, if you're suspecting it, the result is back through a colposcope that can be treated. Colorectal cancers, again, you have adenomas, which take about 10 to 15 years to develop into cancer. For oral cancers, again, you have this whitening called leukoplakia or erythroplakia because of constant irritation. And if you stop chewing tobacco, and that gets back to normal. So all of these, I think, can be, and again, for lung cancer, it's the same thing. So for breast cancer, a mammography, a clinical breast exam, breast awareness for me, I think is the most important and cost effective. I feel you should know what is normal for you. And I'll talk about this in a minute. So again, these are some of the risk factors for breast cancer, and lack of exercise. You're twice more likely to develop breast cancer if you do not exercise. Obesity versus normal weight, again, increases your risk of breast cancer. So, maintain a healthy weight. That is very, very important. And a lot of times I hear that, I'm not able to lose weight. So sometimes, with menopause, we will put on weight, but it's very important that we have a good diet, sleep pattern, and an exercise discipline. If you're doing all of that, I think that's half the battle won. So all of these, being a woman you are at risk. So it's very important that we take our health in our hands and try and do all of these things which we can control. So I really wanted to show you this because this applies for patients with breast cancer as well. This study showed that, if you had a low fat diet, the risk of developing breast cancer was 10% less. But if you had breast cancer, the risk of recurrence was actually 25% less if you had a low fat diet. So I think, and again, Claire talked about it very nicely. I won't repeat it because you can have access to those slides and her lecture as well. That saturated fats are the ones that you need to avoid in your diet. Exercise, again, huge study with 74,000 women who participated, showed that there could be a 25 to 40% decreased risk of developing breast cancer. And the benefit was the greatest in thinner women. So it doesn't, if you're thin, doesn't mean that you shouldn't exercise. I think all men and women should exercise, irrespective of whether you are thin or not thin, because the lifetime exercise also matters, this study showed. Even if you do modest 1 to 3 hours of brisk walking per week, that had a huge benefit in decreasing the risk of developing breast cancer. As far as alcohol is concerned, I think any amount of alcohol is bad. There is a 10% increase in the risk for breast cancer for every drink per day. So I really wanted to show this because I get this asked a lot about developing breast cancer, about hormone replacement therapy. So you can see that the risk was much higher of developing breast cancer if you were taking hormone replacement therapy versus placebo. But if you were taking an estrogen only replacement therapy, the ERT, the risk goes down by about 25%. So taking estrogen replacement therapy is safe. So I've talked about this before, who should undergo genetic testing. Like I said, if you have multiple close family members affected with breast or ovarian cancer at a younger age, just take some advice. Just speak to your physician, your gynecologist, or any doctor. Or if you have family history also on the father's side, I think this applies to males in your family as well, because breast cancer can affect males also. We know the UK statistics. I know that because about 700 to 800 men develop breast cancer. I don't have the statistics from India, but usually the male breast cancer is genetic. And if your father or your grandfather has developed breast cancer, then one should start screening a decade earlier before the family member was diagnosed with breast cancer or any other cancer with a family history. So again, screening methods for breast cancer, like I said earlier, a lot of young women are developing breast cancer, and I keep getting, and most of them present with late stages. I think the reason is because there is no screening modality for young women that we recommend. But I'm part of this European group of European Society of Oncology, young women with breast cancer group, and we talked about this, that what should be recommended. So it was felt that if you had a digital mammogram with a digital breast tomosynthesis, that would be a screening method that could be recommended for younger women between the age of 45 and 50. After 50, I think you can have an annual mammogram for average risk women. Again, I would urge you to check that wherever you're having your mammogram, check that the place has a digital mammogram. The reason why this is important is the quality of image is better and the dose of radiation is less if the place has a digital mammogram. Even for your breast follow-ups, when you're having annual mammogram, I would urge you to question the place wherever you're going and not have a mammogram at a place which does not have a digital mammogram facility, because why expose yourself to more radiation and a poorer quality image? If you're having, like some of our breast cancer patients, I would recommend them to have an MRI scan, especially if they're young. And some patients would present to me, let's say, with a breast lump. I would do an ultrasound. It's not able to see, mammogram, again, not very clear. So I would do an MRI scan because younger women have dense breasts. So mammogram and ultrasound may not pick up the lump actually, even though you can clinically feel it. So I would do an MRI breast. So make sure that if you're having an MRI breast, or if you have a loved one who's going for an MRI breast, you need to check that the place has the MRI with the breast coil. Because if the place doesn't have a breast coil, yes, the scan will be done, but the quality of the images will be very bad and almost unreadable. So I think the reason why I do these is to empower patients and educate patients themselves as well, because I think you need to drive this within your own community. So again, breast self-exam is important. It at least tells you, does not improve, like I said, the overall survival, may cause excess benign biopsies as well. But again, it's important that a clinician examines you afterwards, and then if you suspect something, and does a simple ultrasound if needed. So I do a lot of screening in the villages. COVID has kind of stopped it. When screening was introduced in UK, the incidence went up, the number of patients went up, but the breast cancer related deaths came down. So I think screening, this is the best evidence, and this is the best slide I feel to show that screening does make a difference. And there's only 1 in 15 chance of being called back for further tests in UK. Women are now having it done from the age of 47 every 2 to 3 years. There's a routine recall and a call system. So again, very important for all of you as well, including when you're on follow-up for breast cancer. If you've had a mastectomy or removal of the breast, always examine yourself in front of the mirror, stand in front of the mirror and see that there are no lumps or bumps. And anything, you may have a mosquito bite or anything that doesn't get better over a period of time, you must get that checked out. So self-examination is very important. In front of the mirror, you stand and you check whether the nipples are in the same line, whether your contour of the breast has changed, whether there is any inversion of the nipple. Some of us have one breast larger than the other breast, you know, that is normal for us. So, but know what is normal for you. So inflammatory breast cancer presents with just an enlargement of the breast. You will not feel a lump. So I've had a few patients who presented very late because they were treated with antibiotics for 1 month, 2 months, 3 months, sometimes with tuberculosis treatment as well, thinking that this is mastitis. So inflammatory breast cancer presents with painful breast and reddening. So it's important that, you know, anything that you have which is not normal, and plus anything that is not getting better, with, let's say, one physician, take a second opinion. Do not hesitate to take a second opinion if you think things are not getting better over a period of time. So cervical cancer, again, what do we know? We, all of us have develop HPV, this infection, but usually it is self-limiting. But it does persist in about 20 to 30% of women. And where it persists, it will cause, like I said, constant irritation, which will lead to CIN, cervical intrathelial neoplasia, which if not treated will develop into cancer. So it's very important that, you know, you have this pap smear done. So it's every 3 years between 25 to 49, and between 50 and 64, it's every 5 years. Again, you know, if it's a pap smear, this is the frequency that is recommended, and I've taken it from the NHS, that is UK. But if you having HPV DNA testing, which is slightly more accurate, you need to do it every 5 years, not every 3 years. Vaccine, I can't stress enough that you must vaccinate people within your circle and educate them to get vaccinated. I'm very happy to talk to take questions on this. Just a few more slides. So like I said, colon cancer, you know, from a polyp, it develops into this and then into a carcinoma. So it takes 10 to 15 years. So even one colonoscopy is good enough, you know, to protect you in your lifetime after the age of 55. But it's an invasive procedure, you know, and I think none of us would want to have it. It's unpleasant procedure. So, but fecal immunochemical test, again, is a very simple thing to do. Colon cancer and breast cancer is rising in Indian metros. So please, please be aware about it, and it can easily be prevented by these tests. So just remember, when you do a stool occult blood test in India, most of the centers do it with a method called the Gayak method. So which means that it costs about 300, 400 rupees, which means that you have to give 6 stool samples, or at least from 3 different bowel movements. I mean, I could not get my uncle and my mom to give one stool sample, you know, when I took them for their screening test. I do that every 2 years. So, I mean, again, you know, they said, no, 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 nothing's wrong with me. And so it's very difficult for to convince your family members also to do the fecal occult blood test. But fecal immuno, so imagine to ask for 6 stool samples from 3 separate bowel movements will be impossible. So that's why fecal immunochemical test is very important, because you only need to do one sample. So I have started that at Max Hospital in Delhi, because that was where I was working earlier. And we're going to start here in Apollo as well. So again, you know, if you are from different parts of the city, go and question the people, your physicians, and this is a kit which can be easily imported by the hospital and can easily be done. In fact, there was a head-to-head study which looked at screening for fecal occult blood, 33% reduction in deaths from colorectal cancer. They also compared the immunochemical test. In fact, immunochemical is slightly expensive, and even the NHS has started doing the immunochemical test from last year. So this trial compared colonoscopy versus the immunochemical test and showed that, you know, they were absolutely equal. And though colonoscopy was better at identifying non-advanced precancerous areas called adenomas. Again, this is a surveillance. If you've had a colonoscopy, you don't need it for 10 years. So just to summarize, this is my last slide. For breast cancer, again, all of us live in India. We have to look after our own health because the government doesn't have a coordinated program. But the good thing is the government has started a national screening program for cervix, head and neck, and breast cancer starting from the age of 30. And that includes a clinical breast exam once a year. So for resource constraint, I have said that at least we should do this breast exam. For no resource constraint, we should do mammogram at least starting from the age of 50. One can argue that it could be 45. Cervical cancer, one could do a visual examination by acetic acid or a pap smear. HPV DNA costs about 2,500 every 5 years. Colon cancer, like I said, GAIAC test, at least even if you do one stool sample, I think it is worth it. The other disadvantage of the GAIAC test is you have to follow a lot of dietary restrictions as well. If you're going to do this stool test. With FIT, you don't have to follow any dietary restrictions. I would suggest doing it from the age of 45 in India. And for lung cancer, if you're a smoker, to do a low dose CT scan of the chest. So I think these are things which we can do easily in our life, and also encourage our loved ones to do it. So again, another question, please clarify about the vaccine. Can it be effective for married women? No, it is absolutely ineffective for married women. In fact, including in my family, I've had cousins who ended up having it because I don't know why. It is only effective before sexual exposure. So, you should encourage your children, your grandchildren to have it. So I've given it to my niece who was 14 at that time. And I have another niece who's 9. So the minute she turns 12, I will give it to her. And the earlier you give it, the better it is actually. And the studies are showing that, the earlier you give it, you may need to give one dose only. But for married women, it is not effective. So I would not suggest it. None of the guidelines recommend it for married women. Does HPV vaccine take care of all cervix? No, actually. So there is a bivalent vaccine, Cervarix, which looks after HPV 16, 18. The Gardasil looks after 4 cervical cancers, but those 4 HPV cause 80% of the cervical cancers. In fact, there is a third vaccine which is now available in the Western countries, which is a 9-valent. I mean, it targets 9 variety strains of the HPV virus. And in fact, I would say Cervarix is also equally good, but for cancer. But Gardasil probably is better for the warts as well, vaginal warts. So I would go for the quadrivalent vaccine. And if you have access to the 9-valent vaccine, I don't think it is approved in India. So Indian Academy of Pediatrics has approved the vaccine, and in fact, Punjab, Delhi, and Meghalaya, some of the states have actually started giving it free of cost to the girls. But for boys, the Indian Academy of Pediatrics has not approved it yet. So we can't give it, but I mean, I think it's a no-brainer. We should really consider it. Any other questions? I think this is a topic which is very close to my heart, and I try and do this as often as possible because I think we have to, as a nation, invest in cancer prevention. And because if we go for these strategies, we can probably diagnose cancers early as well with screening. So why concentrate on HPV only? So, I mean, because we have a known virus, which we have a known causative factor, which we have, and that's why we can target that, and there's a vaccine available. For hepatitis B, again, we know that it is Hep B related liver cancer. So we can target that. And for H. pylori is another bacteria which causes stomach cancer. Again, a lot of research going on. but that is easily eradicable by antibiotics. So again, I think the key is don't ignore if you have any symptoms. So great learning. Kindly give the site for reading the saved lectures. Okay, Sachin, can you tell us which site can we get the previous lectures? Actually, Rob's talk was also fantastic. I've had lot of messages separately as to where can they access Dr. Coleman's talk as well
Ma'am, it's on your YouTube
on
page
bone
actually.
health. I think we've
Uh,
had some fantastic. I would love to hear from you. What would you like to us to tackle next? I was thinking of cancer survivorship as to what, and maybe one of you could talk as well. I was going to talk on all the long term side effects that these treatments can cause and what we can do about it. I think we've addressed each of these separately. We've had Anne Armstrong talk about vaginal dryness and menopausal symptoms. We've had, okay, it's on my YouTube page. Okay, yes. So it's on, so if you just, I need to Google it as well.
yeah, yeah. I will
So,
just put it in the group.
so I will. So I think if you go on maybe put Google, put my name and then YouTube, probably hopefully it'll take you to it. I will also try looking at it today. So we've had some fantastic talks from. We had Dr. Sareen, Dr. Rajiv Sareen talk about BRCA testing. So I think over the since COVID, we've had some fantastic talks. So side effects is welcome again, especially of letrozole. Yeah, so I think let me talk about side effects of hormone therapy, and maybe I'll get somebody who's a world expert on this and who's published on this as well. Because like drugs like letrozole, and in fact, my friend Susie Stanway has published on this, can cause cardiac issues as well. So one needs to be aware about these because, like I said, we've become better at treating breast cancer. So our patients are living longer. They are taking these treatments for 5 years, 10 years. So I think very important that we talk about. I think it's a very good idea. I will talk to Susie today about long-term effects of endocrine treatment. She's published it in a fantastic journal. And targeted therapies. Yes, Vandana, that's a great idea. So I think we'll talk about targeted therapies as well. I think it's important to know what is available and immunotherapy and targeted therapy and where it applies. Huge controversy in breast cancer about immunotherapy as well, because one study was positive and the other one was negative. So I think it's very, very important that we try and within the medical community find out. Great. Thank you, everyone. Lovely to see you. Such a pleasure.